Well, we all watched recently as Savannah and Dylan gave birth to their two beautiful baby boys. So for all of you new moms out there who perhaps are going through the same thing that they are, we thought it'd be helpful this morning to have a pediatrician on to give you some peace of mind. So we're so happy to welcome back Dr. Tonia Cox with CHI Memorial Pediatric Diagnostic Associates. And today you're talking about that all necessary, but often too little of it, sleep.
Sleep, yes, and particularly safe sleep. And this is a topic that a lot of new parents have heard about, but I think it's important that we retouch on it because every year more than 3,500 infants die in their sleep. And the majority of those deaths are due to unsafe sleep practices. Okay. So I wanted to come on and talk a little bit about safe sleep.
Now you said there are some new findings out there a little bit.
Well, a couple recommendations have been updated by the American Academy of Pediatrics, and that is based on new data that has become available on infant mortality. And so some of the recommendations have been tweaked just a little bit. So number one, the most important thing is that babies sleep on their back, okay? They need to sleep in their own space. Okay, so we do recommend rooming in. So, and that's one thing that's changed, that's been updated, that it's recommended that babies sleep in the same room as their parents for up to the first year of life. It was previously recommended up to 6 months, so it's now recommended that they room in with their parents until they're 12 months.
Okay.
That's best practice. And then as far as sleeping on their back, that is really important that whenever they're asleep, they should be on their back. They should spend time on their tummy during the day. So multiple periods during the day where they're active, when they have their little alert awake time, that they're on their tummy, because it helps build strength in their neck and their back, their core muscles. And it's also important to relieve those pressure points on the back of the head to get some tummy time.
How much tummy time do they need?
You know, that's not an exact number, but I say during those awake times when your baby's alert, just place them on their tummy. If they don't particularly like it, and some newborns don't like to be on their tummy, lay down a quilt on the floor and get down there with them and talk to them and engage them. And sometimes if you're actively plugged in with them, you can get a little bit more time out of them. If your baby is crying inconsolably because they're on their tummy and they want to be picked up, pick them up.
Okay.
But just try multiple times through the day to get little spurts of tummy time.
Okay, it is, especially with your first child. It's unnerving when you put them to sleep for the first time. And babies, even brand new infants, move a lot.
Oh, they do. A lot of new parents are surprised at how active and how noisy babies are when they sleep.
Right.
For sure.
So if you put a baby down on his or her back and they scoot a little in the crib, how do you know when to worry? How do you set the crib up? Do you want to do away with the bumper bars?
Yeah, so that's another really important key, is that they need to be on a safe sleep surface. So that means not in the bed with the parent, and not being held if a parent is drowsy. So in a crib or a bassinet, and it needs to be safety approved by the Consumer Product Safety Commission. Okay. And everybody can visit their website at cpsc.gov. They safety rate all sleep surfaces, so cribs, bassinets. So it needs to be a safe sleep surface with a firm mattress that fits snugly up against all of the corners. We don't want any gaps or anything that a baby could scoot and get entrapped into. It needs to be a pretty firm mattress with a fitted sheet on it.
Okay.
There should be no loose bedding. That includes blankets, pillows, fluffy bumpers, and we certainly don't want to have anything that could pose a strangulation risk. So no, don't use the lanyards on the pacifiers in the crib. Definitely no necklaces on babies when they're sleeping.
So you're saying if you have a wintertime baby, if you're putting your baby to sleep now on a January cold winter's night, don't put a blanket over them?
No. We want to keep the ambient room temperature approximately 70 degrees, okay? You definitely don't want to overheat a room, because that could pose a risk for baby as well. So you want a comfortably warm room, and then what we recommend is using a sleep sack, or actually like fleece footed pajamas that you can zip up. Now for newborns, when you bring a baby home from the hospital, they are used to the womb where it is snug and tight and cozy, and a lot of times they like to be swaddled.
Right.
And so a tightly tucked swaddling
That's okay.
That's okay. We just don't want like a fluffy blanket laid over them or anything loose that could come up around their face
because they are
sleep.
going to move, and then they could
yeah.
get stuck underneath it,
Yeah.
and they can't necessarily get it away.
Right.
Okay, talk about the noisiness of the baby and when a parent should worry if they make little gurgling sounds. I've forgotten so much,
Oh
but
my
it's
gosh.
alarming when you put them to sleep for the first few days.
It really can be, and so a lot of noise is to be expected, grunting.
And their breathing patterns are different, right?
Yes, you're exactly right, and I get this question quite often because babies' breathing patterns, oftentimes they have a panting kind of breath where they will take little short breaths, and then they'll sometimes pause for multiple seconds and then have a deep, almost gasping breath. And that can be really alarming for new parents. So it's important that they know that that's normal. And if you're ever worried that that panting is something that's abnormal or that they need to worry about, look at your child. If they are peaceful and calm and they're panting, it's fine. It's fine. But if they look scared, if they look like they're in distress, that's something to pay attention to.
You were on the show before the holiday season got into full swing, and you were talking about the importance of your children and routine.
Yes.
So with a baby, the routine is important, right, to establish those sleep patterns?
Oh yes, it is. It's recommended to have a pattern of waking up, going ahead and eating, having a little active time, and then going to bed, so that eat, active, sleep pattern is what's recommended. So we don't ideally want to reinforce the habit of babies having to eat in order to fall asleep, because not so much in the newborn period, because they're waking up to eat every 3 hours on average. But as time goes on and we want them to be sleeping longer at night, we don't want them to continue to feel like they have to eat every 3 hours in order to continue to be asleep.
Okay.
Yeah.
Can I ask you something else?
Sure.
I'm remembering back. So as they get a little older and you have the pacifier, do or do not let them fall asleep with the pacifier?
It's fine. And actually, yeah, there are a couple of other little things about safe sleep that have been shown to be protective factors, so reduce the risk of your baby having SIDS, or sudden infant death syndrome. So pacifier use has actually been shown to have a protective effect.
Great.
Yeah, so it's fine to let them have their pacifier. It's recommended to have no cigarette smoke exposure for babies. That is a definite risk factor for SIDS. Breastfeeding has been shown to have a protective effect, and air circulation, curiously enough. So if you have a ceiling fan and you can just let it run on low just to keep the air moving in the room where the baby's sleeping, that's been shown to be protective as well.
And if you are expecting a baby and you're looking for a pediatrician, I can tell you that Dr. Cox will be very eager to have you come, because you encourage parents to come and talk to you, right?
Oh,
before they choose their pediatrician.
We love prenatal visits. Yeah, it's always a fun time when everything is expected and parents are anticipating their baby's arrival. It's a really fun time to touch base and kind of prepare a little bit.
So keep your baby in the room with you until they're 1.
Yeah.
And keep that air circulating and don't cover them up.
Right.
All right, all good tips.
Yeah.
Did we touch on everything?
I think we got everything.
Awesome.
Yeah.
You can find her on 2 different locations, Glenwood Drive at the main offices there at Memorial, also on Gun Barrel Road, and conveniently enough, her phone number is 698-BABY-2229. Thank you so much.
Oh yeah, my pleasure.
We're back after this.